A coalition of civil society organizations has publicly condemned the National Assembly reintroduction of the death penalty for drug-related offense, calling for its abolition at both federal and state levels. The coordinator of the campaign against death penalty for drug offense, Barrister Okereke Chinwike, made this call during a press conference on the 2024 World Day Against the Death Penalty in Abuja. Chinwike criticized the Senate's recent decision to amend the National Drug Law Enforcement Agency Act, shifting the penalty for drug offense from life imprisonment to the death penalty. He expressed concerns over the lack of public engagement in these legislative changes, noting that stakeholders from drug policy, health, human rights and justice sectors were largely excluded. He urged President Bola Ahmed Tinubu to withhold assent to the bill unless the death penalty provision is removed, emphasizing that drug offense should not warrant capital punishment.
The death penalty is for those involved in the manufacture, processing of dangerous drugs, and those who engage in trafficking of hard drugs in the country for people to consume. The capital punishment also applies to the cooking, preparation, trafficking, as I said, dealing in or delivering of hard drugs by enemies in Nigeria. The Senate also, as part of the review of the punishment in the new bill, they also increased the imprisonment without option of fine for drug consumption in Nigeria or illicit drug use of illicit drugs to 15 years. They increased it to without option of fine. The penalty should be abolished for all crimes, including for drug offenses, and law enforcement in drug control effort should be consistent with the state's human rights obligations. However, in opposing and rejecting and condemning the death penalty for drug offenses in Nigeria, we are in no way seeking to minimize or condone drug-related crime, for which the death penalty was recommended and approved by the 10th National Assembly. The death penalty is not a solution to criminality. And evidence from our works over the decades and other activities from all the stakeholders have shown the reluctance of the state governors in signing death bail warrants and public execution on those on death row. We call on the National Assembly to remove the inclusion of death penalty as a capital offense for drug offenses in the bill for amendment of NDLEA Act, which is presently before them. The number is HB 472. The bill HB 472. The death penalty provisions in that bill should be removed. That's what we are demanding and asking. We call on the President of the Federal Republic of Nigeria not to assent to any bill for an act to amend the NDLEA Act. We call on the federal government to take action and reform and harmonize all drug laws on the basis of existing and emerging minimum health and human rights standards, and advance drug policies that address social inequalities and root causes of drug-related issues, as well as promote non-stigmatizing attitude that deter access to drug treatment, rehabilitation, and harm reduction services.
When you criminalize people because of their drug use dependence, most times you make them go to the underground, you make them feel, as if they are not worthy of receiving healthcare services. So we are coming from an evidence-based approach. If you are criminalizing all these decades, has it worked? Has it, bring out the positive effort or positive impact that we're looking forward to? It hasn't. So let's reconsider. When you criminalize drug users and you raid their bunks and you arrest them and you take them to jail, does that change or does that stop them entirely from using drugs? No, it doesn't. When you do that, you increase sickness and diseases in the community. See, this is counterproductive. The Nigerian Federal Ministry of Health is one of the Federal Ministry of Health around the world. I think one of the even first to be championing harm reduction in the country. So for we to have another parastatal of government or another system of government coming to make that effort look as if the decision of the Federal Ministry of Health to key into harm reduction is not the best. This is also counterproductive. Please, it should be considered, please. Also encouraging that attention should be moved towards harm reduction, towards treatment and care, towards rehabilitation, towards healthy practices that help people come out instead of for them to run away from, the society whenever issue of drugs comes up.
The proposal of death penalty contradicts the ongoing implementation of harm reduction program by the Federal Ministry of Health for persons who experience drug dependence. As part of the public health response to control drug-related harms, HIV burden, viral hepatitis, tuberculosis, this law greatly negates all these efforts. On this day, our call is simple. We urge the members of the public, the government, all civil society to join their voice to advocate for the removal of death penalty and call for actions that invest and focus on harm reduction program to improve access to treatment and address the underlying social determinants that lead people to engage in drug use.